Okay, welcome to the mental disorders unit. Let's jump ahead. Okay, oftentimes when psychology students are going through the mental disorders unit and that associated material, it is very common for students to learn about these disorders and then think to themselves, oh my God, that describes me perfectly. I must have depression. I must have one of these anxiety disorders. I must have OCD. Well, we have to make a distinction here between what is typical, normal, healthy behavior and what is unhealthy behavior that meets the clinical definition of a mental disorder. The clinical definition of a mental disorder is that it is prolonged maladaptive behavior. And we're going to dive into that definition a little bit deeper later on. What that means is that the behaviors that these mental disorder descriptions are describing are there for a long period of time, oftentimes for more than a month. They have sometimes a daily impact on someone's life, and they're maladaptive, meaning that they harm the individual's ability to behave in a normal, healthy way. So, for example, when we talk about obsessive compulsive disorder, this is a very common one for students to think, oh my gosh, I must have some form of OCD that describes me exactly. Well, a lot of us are just kind of neat and tidy people. A lot of us like to clean the kitchen or the bathroom in a particular way. We like to keep it neat and tidy. That is not OCD. I have a friend in grad school. She kept her closet extremely organized. It was color coded. It was arranged by different, shirts, pants, everything else. And as a joke, some other friends went into the closet once and mixed it all up. It wasn't color coded anymore. It was a little disorganized. And did she freak out? Did she have a meltdown? Did she have a psychotic break? Was that a traumatic experience for her? No. She laughed it off. She thought it was pretty funny. And she reorganized her closet and went about her day. So that is not OCD. That is well within the normal boundaries of healthy behavior. So let's talk about some of these disorders. So we have to start with a definition of what a mental disorder is. So this is a contentious topic because depending on how we define a mental disorder, that is going to have huge ramifications. And as our society has progressed and changed over the decades, we have changed the definition of a mental disorder, what meets that definition in the first place. For a long time, homosexual behavior was thought to be a mental disorder. Nowadays, we no longer think like that. So, our definition of what is a mental disorder changes over time, and it changes with societal standards. So that's criteria number one. For something to be considered a mental disorder, it has to be socially abnormal. And what is socially abnormal? That varies with time and culture. So what might be considered normal today would be considered abnormal 100 years ago, or it might be considered abnormal in a different culture. So social norms and mores definitely have an influence on what we consider to be a disorder. And next, a mental disorder or behavior has to be maladaptive. And what I mean by maladaptive is harmful in some way, either harmful to the person physically, it could be harmful mentally, it could harm the social relationships that that person has. It could be bad financial decisions, bad health decisions. It has to be harmful, and that's a pretty broad term, broad definition for harmful. And then lastly, it has to be unjustifiable. And this one's kind of cut and dry. A good example of this. So if there is a good reason for a person to be acting in a socially abnormal, maladaptive way, it's possible they could be doing something silly like method acting. They could be preparing for a role in a movie or a play or something. So they're acting in a socially abnormal, maladaptive way just to get in the mindset for that role that they've got coming up. That would be a good reason, I guess, to act that way. Okay, so let's go back in time and look at some historical perspectives of mental disorders. So, this has confused and befuddled people for hundreds and hundreds and hundreds of years. I would even say tens of thousands of years. Um, it was really only in the last 150 years that we've been able to explain mental disorders in anything resembling a satisfying way. So, some of the historical causes that people thought were responsible for mental disorders were things like evil spirits. The ancient Greeks sometimes thought that um, someone who was suffering from a mental disorder was a vessel of the gods. They were somehow trying to transmit, the gods were trying to transmit a message through this person to everyone else. Lunacy, that term actually comes from the root word lunar. There was thinking for a while that the full moon causes mental disorders. Humors, that was another popular one. The idea was that we have multiple humors in our body, and when they get out of balance, that causes mental disorders. Those are all, um, in today's perspective, they're pretty silly explanations for mental disorders. And the treatments for mental disorders were barbaric, absolutely without a doubt barbaric. Some of those treatments are listed at the bottom of the slide there: exorcisms, caging, beating, burning, castration, mutilation, animal blood transfusion, just terrible, awful ways to treat mental disorders. It was actually a sport. It was a hobby or entertainment for the upper classes back in medieval Europe to actually go tour the insane asylum. They would, dress in their Sunday best and walk through the insane asylum and be entertained by the people who were uh, suffering some of these awful, awful treatments. Truly some of the worst of humanity there. More modern perspectives, we know a lot more about mental disorders nowadays, and we can definitively say that um, they are not caused by the moon, excuse me, or the humors being out of balance, or the gods trying to speak through us. We have a little bit more enlightened ways of thinking these days. So remember, we talked about the medical model a long time ago. So the medical model focuses on physical causes. Any uh, behavioral symptoms of a mental disorder are a manifestation of some underlying physiological problem, whether that's an imbalance of neurotransmitters, an imbalance of hormones, or a lesioned organ in the brain. There's some physical cause for the behavioral symptoms that we are witnessing that are socially abnormal, maladaptive, and unjustifiable. We also have to talk about the biopsychosocial model. So, this has been a reoccurring theme throughout this course. This is where we look at the biological side of things, the social side of things, and the psychological side of things, and we look at how they interact to produce these behavioral symptoms. So, some examples of biological causes might be genetics, neurobiology. Some causes on the psychological side of things might be learning, memory, life experiences, or trauma. And some causes on the social side of the triangle might be interactions with others. Excuse me. All right. So these are our modern perspectives. And yes, here's a little graph showing that they all interact. Yes, yes, yes. So let's talk about how we actually classify them today. Uh, we use something called the DSM, which stands for the Diagnostics and Statistics Manual. This is sort of the clinician's Bible. It's currently in the 5th edition. It goes through a revision sort of regularly. Now, if you remember back to the intelligence lecture, I talked a little bit about standard deviations. And the same story is here with mental disorders. When we're talking about behavior, behavior is abnormal if it is more than 2 standard deviations from the mean. So that includes 5% of the population. 95% of the population will be within the definition of normal. So, is it helpful to label mental disorders? Well, yes and no. Some of the cons of labeling a mental disorder: number one, there is social stigma attached to mental disorders. Uh, I would argue, that has decreased in the last few years. It is certainly still there, but it's becoming much more acceptable, and the social stigma is lessening. Another thing is that we can create what's called a negative feedback cycle. So an example of this would be someone getting a diagnosis of depression, and then they think to themselves, well, I can't get better, I have depression. And so they stop trying to get better. That label is sort of something they can fall back on and lean on and just sort of use as a crutch. Like, well, I can't get better, I just have depression. I can't get better, I just have OCD. That's just who I am. It's a part of who I am. But the benefits outweigh the drawbacks. Some of the pros that come with labeling mental disorders: number one, we can communicate between clinicians about certain cases. It gives a common vocabulary for clinicians to use when talking about different patients. It allows us to comprehend the causes. It allows us to help with treatment selection. And lastly, this is kind of a weird modern thing, especially in the United States today, but having a diagnosis of a mental disorder does help with insurance payments. All right, so we're going to talk about some specific disorders now for the rest of this lecture. And we're going to start with the first 3 there that are in bold: anxiety disorders, eating disorders, and sexual dysfunctions. And then in the next lecture, we'll get into mood disorders and schizophrenia. So let's start with anxiety disorders. Anxiety is normal. Stress is normal. However, it becomes a disorder when anxiety is overwhelming, meaning you can't do anything in the face of that anxiety. It is crippling. It also becomes a disorder when it is persistent. So we all have those moments in our life where we're simply overwhelmed by the to-do list. We're simply overwhelmed by all the things we need to get done. But if those feelings are persistent every single day for weeks on end, then that is something that's starting to look like a mental disorder. And also, if the anxiety reducing behavior is dysfunctional, and we'll talk about that when it comes to OCD. So the first one is generalized anxiety disorder. This is a very well named disorder. It's exactly like it sounds. This is sometimes called pathological worry. Twitching, sweating, tapping your fingers, chewing on your lip, very fidgety. People who suffer from this are also often sleep deprived because anxiety is not allowing them to get good sleep or much at all of it. Oftentimes, this causes an inability to focus. They're constantly worrying about something else except the task at hand. So, it's generalized anxiety disorder. There's really no one thing that the anxiety can be pinned on. It might be many things, but it's just sort of a general sense of anxiety. Like I said, it's a very well named disorder. So to get a diagnosis of generalized anxiety disorder, there needs to be these symptoms present for 6 months, and like I said, it needs to be maladaptive, meaning it needs to interfere with normal functioning. So maybe they've lost their job, or they keep switching jobs because they can't hold down a job. Maybe they're losing friends. Maybe they're getting divorced. It's affecting their life in a negative way somehow. Unfortunately, when it comes to generalized anxiety disorder, roughly 2/3 of the people that suffer from it are women. So it seems to be a disorder that affects women more than men. But the good news is, the older we get, the less likely we are to suffer from generalized anxiety disorder. After age 50, we see a pretty significant decline in the prevalence of generalized anxiety disorder. Next up is panic disorder. This is your panic attacks. So a panic attack feels a little bit like a heart attack. It's an overwhelming sense of dread. Some of the physical symptoms are, your heart is beating crazy. You have shortness of breath. You might feel like you're choking. You might feel dizzy. Um, it's pretty horrific to see someone go through a panic attack. There's in a lot of ways there's not really a whole lot you can do to help them. The cause of a panic attack is not always apparent. Sometimes it is. We'll get to that when we talk about phobias. But it's not always apparent. It might be that kind of generalized worry, that pathological worry. But this panic attack is definitely a debilitating, awful, traumatic experience. And oftentimes, what we see is that this creates a fear of having another panic attack. So it's not just that the panic attack is bad, but the fear of having one causes them to engage in more maladaptive behavior. Oftentimes, people who suffer from panic disorders become antisocial. They don't go out in public anymore because they're afraid of having a panic attack. Smokers, if we have any smokers out here, or vapors, or people who ingest nicotine on a regular basis, they have double the risk of experiencing a panic attack and being diagnosed with panic disorder. Nicotine is actually a stimulant. It makes you feel calm, but it's actually stimulating a lot of your body. Next up is phobias. And I've got a short YouTube video linked on the Canvas website there. This is a video of a woman who suffers from a phobia of birds. So you can kind of see that. I think it does a great job. She's really open about it. She knows that it's irrational. She knows that there's no reason for her to be afraid of birds, but she is, and she talks about some of the ways in which it negatively affects her life. So, a phobia, it is an intense, irrational fear of an object, activity, or situation. And more specifically, the attempts to avoid that object, activity, or situation cause dysfunctional behavior. So in that video, you're going to see this woman. She's afraid of birds, and she's telling this story of being at the beach one day with her granddaughter and her. I can't remember if it's her daughter or granddaughter, but she sees a bird, and the bird is not attacking her in any way. But she has, this huge fear of birds, and she ends up running away from the beach, completely abandoning her daughter or granddaughter in the process. And afterwards, she just like stops, takes stock of the situation, and realizes, like, holy cow, I just abandoned her. I can't believe I did that. So she's really mad at herself for that. These phobias, they can occur for almost any object, any event. They don't necessarily have to be, the stereotypical things like snakes or spiders or anything like that. And it's really important to, again, make the distinction here between normal and abnormal behavior. A fear is not a phobia. So I would, put myself in this category. Like, I don't really like doctor's offices. I don't really like getting shots. I don't like getting blood drawn. It actually makes me a little bit nervous just to even go to the doctor. And if I'm going there knowing that I'm going to have to get a shot or get blood drawn, like that makes me nervous for the whole day, probably even the day before. I don't like going to the doctor's office. That's a fear, though. That's not a phobia. I still go, I still get my shots, I still get blood drawn. Yeah, it makes me a little queasy, a little uncomfortable. I get a little sweaty, and my heart starts racing as it gets closer and closer to the time. But that's not a phobia. That's clearly a fear. It's not negatively affecting my life in any real significant way. So, some common objects or events that people have fears of. This is kind of a goofy graph. The blue represents people that are not at all afraid of it. The red or orange represents people that whatever the object is bothers them slightly. And that teal or green color, that represents people who say they're actually afraid of it. So, the more green, the more people that are afraid of that thing. So on the far left of the graph, we've got snakes. That seems to be the thing that people are most afraid of. About 40% of the people saying they're afraid of snakes. Heights is the second one. Mice, that kind of surprises me. I did not know that that many people were afraid of mice. Flying on an airplane, I can understand that. Small spaces, so like claustrophobia, and then it gets smaller and smaller and smaller as you go down the line. But snakes, heights, and mice flying on an airplane seem to be some of the more common things that people are afraid of. Okay, moving on to obsessive compulsive disorder, or OCD. So let's talk about obsessions and compulsions first. An obsession is a repetitive thought. So a thought that you just can't get out of your mind. You can't stop thinking about it. You can't stop thinking to yourself, oh my God, did I leave the stove on? Did I leave the stove on? Oh my God, did I lock the door? I simply can't remember. Oh my gosh. And then it kind of ruins your day. You can't focus on anything else. You can't get that thought out of your mind. So that's an obsession. Compulsion is a repetitive behavior. So a repetitive behavior might be constantly checking to make sure you turn the stove off, or constantly checking to make sure you lock the door. You might have to check, once every 10 minutes just to make sure you actually turned it off or you actually locked the door. So obsessions are thoughts, compulsions are behaviors. And again, we have to make a distinction between normal and abnormal here. So, um, a great excuse me, a great example would be germs. Um, this is a very common thing that people who suffer from OCD think about. They think about germs on their skin, on their hands, being out in public, touching things that other people have touched that aren't clean, and the compulsion here would be hand washing. So people who suffer from OCD, they will not be able to focus throughout the day because they're constantly thinking about germs. And they might even be constantly washing their hands throughout the day, to the point that their hands might even be cracked and bleeding from all the soap that they keep applying, drying out their hands so much. So if it gets to a point where, you can't keep a job because you're constantly washing your hands, or, you're spending so much time in the bathroom washing your hands, or, it starts hurting your relationships, that is indicative of a disorder. That is abnormal and maladaptive. But if you're thinking to yourself, I haven't washed my hands in a while and I'm about to eat a sandwich, and you go and eat and wash your hands, that is clearly normal behavior. There's also, it's pretty common for people who suffer from obsessive compulsive disorder to obsess over something terrible happening. So they'll keep checking to make sure their doors are locked, that the stove and oven are off. Or another example would be they think that their brakes in their car might stop working at any moment, so they're constantly checking to make sure that their brakes work. Next up is post-traumatic stress disorder, or PTSD. So, post traumatic stress disorder occurs after a traumatic experience. This is very common in soldiers coming out of combat situations. And now, people who suffer a traumatic experience and have stressful thoughts about that traumatic experience, that is normal behavior. That is actually adaptive behavior. It helps us avoid those situations in the future. Now, it becomes abnormal behavior when those thoughts about those traumatic events negatively impact our normal functioning. So, if you can't stop thinking about a traumatic event and it's negatively impacting how you function on a day to day basis, that's when it becomes abnormal. And this is just like any other anxiety disorder. Some of the common symptoms we see are things like insomnia, social withdrawal, anxiety, going back to generalized anxiety disorder, very, very similar symptoms here. These can trigger panic attacks as well. Now, it's important to note here that after a traumatic event, roughly 5% of people experience PTSD. Many people will actually say that they experienced some sort of post traumatic growth. So they learned some lesson, or I wouldn't say maybe learned a lesson, or they filed that away in an experience that they certainly don't want to experience again, but it was certainly a defining moment of their life or something like that. So it is possible to kind of turn a negative traumatic event into something positive. All right, so let's talk a little bit about the causes of anxiety disorders. That's what etiology means, the causes of anxiety disorders. So we can take some different psychological perspectives here to try and explain where these anxiety disorders come from. We can talk about classical conditioning, and we can talk about stimulus generalization. This is one of the ways that PTSD is explained. So you can imagine in a combat environment, there's usually a lot of loud explosions going on. Some of those explosions might be very violent, and they might be very close, and they might be deadly. Now, when that person is removed from a combat environment and they're with their family on the 4th of July and there's a lot of fireworks going on, that person might generalize the combat experience with those deadly explosions to the fireworks that they are witnessing and have a very similar response to those fireworks. Uh, in insane increases in anxiety, things like that, possible panic attacks. We can also use the principles of operant conditioning. Maladaptive behavior decreases anxiety, therefore it is reinforced. So going back to our OCD example, that person who has obsessions about germs on their hands, so they're constantly washing their hands to the point that the soap is drying out their hands and making them cracked and bleeding, and they're spending, hours a day simply washing their hands. So they have those obsessions, they have those repetitive thoughts. And the only way to relieve the anxiety of those repetitive thoughts is to wash their hands. So every time they wash their hands, they have a reduction in anxiety, which feels good. Therefore, that hand washing behavior is reinforced. They're more likely to wash their hands in the future because it reduces their anxiety. So you have this feedback cycle. And lastly, observational learning. We often learn our fears from other people. If your dad or mom is afraid of snakes, it's likely that you will be afraid of snakes as well. You learned that fear from them. And we see this in monkeys as well. Monkeys that are raised in a laboratory environment are not afraid of snakes. Wild monkeys tend to be very afraid of snakes. But if you put laboratory raised monkeys in the wild with wild raised monkeys, those laboratory raised monkeys will soon learn to be afraid of snakes as well. They learned that fear of snakes from their wild monkey brothers. Okay, we're pushing right up to the 30-minute time limit here, so I'm going to stop this video and get ready for the next one.